looking at integrative oncology from this PNI basis, when we assess a patient, we will not only look at the biology of the patient and look at their their CT scans and their lab results and examine the patient. We will also ask the patient how or she eats, what he eats, how he keeps weight, if he or she does exercise, how or she sleeps. So all these lifestyle habits. But we will also ask the patient how he thinks. What are the thoughts that are ruminating in his or her head, or how he deals with emotions. Like someone here is saying, no university teaches self-love. Of course. So how does that person deals with negative emotions, and how does person cultivates positive emotions? So this will affect his health. And then the socioecologic, which environment that person is in, at home, at work, within his friends. Also the physical environment, that is this person enough in contact with nature or not? And the spiritual level, is this person really connected to what is important for him or her in life, to what gives meaning to their life? We all know of cases who, after a loved one died, and 3 months later, the loved one died without having any previous diagnosis. So there is some spiritual connection. When we lose our main focus, our main meaning, our main purpose in life, we may become sick, and very, very rapidly. So therefore, integrative oncology, we will attend not only the physical needs, but also the psychospiritual needs and the social needs. And this is a slide from Lorenzo Cohen, which is the head of integrative oncology at MD Anderson Cancer Center. And as we can see, there is a myriad of treatments. It's not only surgery and chemotherapy and radiation therapy, but a whole myriad of treatments that will affect the health of that person and might help him or her to recover health after a diagnosis. So we need to understand which is needed for every person. Not everybody needs everything, but what is needed for everyone. And this is a paper that in 2018, it is only in 2019, that the ASCO, the American Society of Clinical Oncology, endorsed and accepted the Integrative Oncology guidelines. The Integrative Oncology Society was founded in 2003. And what they did is they started publishing these guidelines, where they show all these complementary treatments like acupuncture, meditation, yoga, and what's the evidence of whether they're safe for the oncologic patients and whether they are effective to reduce some symptom or to improve recurrence-free survival, etc. So this is an excellent paper where it reviews more than 200 randomized studies and shows what level of evidence there is to use acupuncture or reflexology or yoga. So there's plenty of evidence to use meditation and yoga and acupuncture in cancer patients. So basically, this when we see a patient through the integrative oncology eyes, the treatment will be the medical treatment, surgery or chemotherapy, hormonal therapy, whatever is really needed. And plus, we will help that patient recover their health. How? Through good nutrition, keeping a good weight, exercising, good sleep, understanding how to deal with stress, and also how to auto-regulate, because we all have stressors in our life, but how to respond to them and how to come back to a balanced system inside. And of course, all the social support and promoting the positive emotions, it's part of the healing, and avoiding environmental exposure. So just here some few slides to show that there is evidence and solid evidence of how diet helps. And nowadays there's a strong interest in seeing how diet will affect all this microbiome within our gut, and will affect our health, but also it will affect how we respond to certain therapies like immune therapy or hormonal therapy, which means that nowadays it's important to know what a patient, how he or she is eating, because if we are going to give some hormonal therapy or some immune therapy, we need that their gut is in good health. Otherwise, there might not be a good response. So it's part of the treatment. For all that are herbs or supplements, I usually consult this Memorial Sloan Kettering Cancer Center database, which is an excellent database. There's so for each of the elements, if you put ginseng or turmeric or whatever you want to put, and it will be an explanation of the compound for in lay language or for medical professionals, and levels of evidence and for what is being used, etc., and cautions to have. Obviously, we'll advise the patient to exercise. If it's in nature, it's even better. There's data now showing that forest bathing, it's very good for health. Sleeping is extremely important. I could talk half an hour about sleep and how sleep activates that brake, that parasympathetic system, and helps us to come back to balance. And obviously, all these, many of these practices that we really owe to you and your wisdom, because for us they all come from our East, you know, from India, and also some from China, but very much from India, meditation and yoga. So all these practices that help us to auto-regulate, to induce our relaxation response, improve our parasympathetic system, and bring us back to balance, bring us back to health. I here added my Spotify and YouTube channel. I have some meditations recorded, also in English, and so people can take a meditation from there. So here's just to show how the relaxation response induces a chemistry that it counteracts all the stress chemistry. So that is why we need to do all these exercises and practices to improve our chemistry inside. And also some other therapies like massage therapy, which has been proven that with some precautions, they can be done in cancer patients. And even acupuncture, which it was doubted whether it could be used safely in cancer patients. There are studies that show that it can, and it does help for a lot of the symptoms promoted by a lot of the side effects of chemotherapy or of the disease or symptoms of the disease in itself. So yes, acupuncture is safe. And also what my way of practicing integrative oncology, I apart from all these practices, I do recommend the patients to really take time to get to know themselves, usually with a psychotherapist, an integrative psychotherapist, and to also look for social support. Today, we know that isolation brings us, increases death. So we need to open up and look for support. Our major way of dealing with stress is through social support, and that's physiologically. I'll show you a slide. So for that, they need to go through some type of therapy that will teach them how to become more resilient, because stressors will come back or will come, there will be new stressors, but how to deal with the stress and how to go back to balance again. And this is, someone was saying, yeah, they don't teach us love. But now we're having data how positive emotions, how a big hug increases oxytocin and decreases cortisol. We're seeing the correlation between positive emotions, our inner chemistry. So, and this just for the ones who need more hard data, just to tell you that there's at least 2 trials, randomized controlled prospective trials, well done methodologically, that do prove that this integrative approach decreases recurrence and improves survival in cancer patients. And there's one trial, this one from the Ohio group by Barbara Anderson, where 227 patients, breast cancer patients, they initially got the treatment they needed, like surgery, radiation therapy, hormone chemotherapy if needed. And then they were either followed in a conventional way or followed for 1 year, the first 3 months in an intensive way, teaching them good nutrition and exercise and relaxation response, and looking for social support and dealing with stresses in life. And the group that was accompanied this intensively, the 3 months and then once a month for the rest of the year, they had increased recurrence-free survival, and increased breast cancer specific survival, and an increased overall survival. So, and this is a follow-up of 11 months. So this is a well-done trial that shows improved recurrence-free and overall survival. And this is a second group, also with 11 years of follow-up by the group of Antoni, and a similar trial in breast cancer patients, also showing an improvement.